come take a look. And I believe in Dr. John, maybe you can tell everybody from a medical perspective how big you think impact will be for the American public, just based on your level of experience in medicine, and also you being on a share, both you and Brooke, for many years, meaning as a medical professional. I'd love for you just to put a little light on that for all of us listening here today.
Yeah. Thank you, Patrick. I appreciate it. So I'm just, I'm honored to be here. Like Brooke said, she's a real estate agent. I've been a medical doctor here in Mississippi for 25 years, and ER doctor, general practitioner. And COVID, has been rough. And I no longer work for the hospital. And so Brooke and I, we're faith filled. I feel like, I just, my main purpose in life really is to help others. And so that's what I've really tried to do in the last few years through COVID. And, I was literally praying, just trying to figure out, what direction to go next. And I didn't want to go back into a hospital setting. But financially, that's, I've taken quite a substantial decrease in pay being in private practice. And so just praying, what to do. And so Jane, our sponsor, called us. We met Jane down in Florida I guess about a year ago. And she's a prayer warrior. We did a lot of praying together. And when she told me about this, I didn't really care what it was. If Jane said it was something to look at, I was willing to look. And when I saw it, Mike Tyson or Mike Bryson and Patrick Mays are there. They showed me this program, and I just thought it was good. Impact sharing. Brooke and I have been on Christian Share, MetaShare for probably a decade or so. And for me, we're generally healthy folks, but we wanted kind of a catastrophic plan in case we had to go in the hospital setting. We could use it. And so impact health sharing is similar to that, but it's much better. And so I just got excited about it. I think it's it's going to revolutionize the healthcare industry, and that people are getting doctors are moving away from the hospital setting, setting up private practice, and they're getting away from these big insurance programs like Blue Cross Blue Shield, because they want to have freedom too. Just like patients want to have freedom to choose what doctor they want to go to, these doctors want the freedom to be able to practice medicine the way they know to help the patient. And these big healthcare insurance companies, many of them are very much tied to big pharma. Just like the COVID vaccines, for example. I mean, pretty soon, if you're, say, a Blue Cross Blue Shield member, you're going to have to be fully vaccinated to keep that insurance, and the doctor is going to have to push the vaccines or any pharmaceutical, whatever the insurance company wants them to push. So I see this as a breakthrough. It's going to revolutionize and help the whole medical freedom movement, and really help create a new parallel healthcare system that's going to replace the old broken healthcare system. I'm excited about it. Yeah. So thank you a lot, Patrick.
Well, first of which, thank you guys.